I'm Dr. Sandra Torres. They call me Lexi. I'm from High School 75. And I am a proud old girl celebrating our 50th year from high school. Unfortunately, when you talk about old girl outside of the assumption context, the only things they'll probably have in mind are these. You must be menopausal, probably have some forgetfulness, maybe cardiovascular problems like hypertension, and then may not be sleeping very well. You could have UTI, gynecologic problems. Some will have a tendency for cancer. But two things which is under my specialty is osteoporosis and arthritis. So not so good being called an old girl, right? So you have unique set of health concerns during this age, and since I'm a rheumatologist, I'd like to discuss osteoporosis and arthritis with you. I've always believed about you should rethink aging. You have to understand first the health concerns that you're facing so that aging is not out of your control, because how you handle it will really depend in your hands. So, let's talk first about arthritis. Ang dami nagtatanong sa akin, ano bang difference ng arthritis and rheuma? Well, arthritis simply means you have inflammation of the joint, so it presents either with swelling, pain, redness, or even limitation of motion. Can affect any joint in the body. So there are more than 100 different causes of arthritis, and the most common that we'll be discussing today is degenerative joint disease, and you may know that as osteoarthritis, and gout, which is secondary to uric acid depositing in joints. The ones that are not as frequent is rheumatoid arthritis and lupus. So, osteoarthritis, I'd like you to see the difference between a normal joint, which just means where two bones meet, and you have a protective covering at the end of the joints, which is called cartilage. When this starts deteriorating and gets very thinned out, you end up with a deformed bone. You'll have enlargements, and that's what you will know as bone spurs or osteophytes. You'll have little fragments of cartilage floating in the joint space, so that can be very painful as well. It can present with pain during and after movement, tenderness, or you get stiffness in the morning as you wake up, parang ayaw gumalaw ang mga joints mo. And even also after any long periods of time that you're not active. You have loss of flexibility, you have this grating sensation. Sometimes madidinig mo na lang siyang krak, 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 or tok, tok, tok. That could be a sign of osteoarthritis. And then as I showed you earlier, you have those hard bumps, which are called bone spurs. It will affect weight-bearing joints because nagdadala siya ng weight, no? So you can have it in the neck, carries kasi your head. The one that carries your torso would be your low back and the hip area, and carrying the whole body will be your knees and ankles and feet. For the hands, it's because marami kang buting-ting, marami kang ginagawa with your hands. So those are the ones that are most used, and those are the ones who will be more prone to wear and tear. You will also see terms like cervical spondylosis in your x-rays, for example, and it simply means that your disc could have degenerated, so they're very narrow and thinned out, and you will also have bone spurs. They may or may not be painful depending if your nerves get compressed or not. Same thing in the low back area, so you will also see lumbar spondylosis, but all it means is that you have arthritis of the low back area. In the knees, you could be either knock-kneed or ito yung picture ng sakang, and there's no alignment anymore. So this can be very painful because if I had x-rays of your knees done, what would show would be a thinned out cartilage. So the black space in between the two bones will be bone to bone. And when that happens, it can be very, very painful. The hard nodules I was talking about are more common on the hands, but if you get it on the base of your big toe, you know that as bunions. We don't operate on this if it's in the hands, but you could probably have surgery for the foot. The heels also can have spurs, and that can be very painful. Yung unang apak sa umaga, we always suspect that you probably have a heel spur. So there's that little extra bone protrusion that can hit against the fat pads of your foot. So what are the risk factors for osteoarthritis? Why would you get this? Well, As you grow older, it's a wear and tear process. So you could get that, but not everybody that's old will get arthritis, okay? So like women are more prone to that when you're obese kasi nabibigatan ng katawan, so ang hirap dalhin. When you've had previous joint injuries, certain occupations that have this repetitive motion, overuse, like even athletes, for example, or those doing manual labor, or it just could be in your family. You will see that among the females, they all have the same hands, the ones I showed you earlier with hard lumps, or only because you've had previous bone deformities. Now, I would have x-rays done, or maybe I would go to the extent of having a musculoskeletal ultrasound or an MRI requested, but there are no specific blood tests that will tell you whether you have osteoporosis or not. Now, how can we prevent this? Unfortunately, if it's familial or genetic, can't change genes. However, if you are obese, you would really want to lose weight. There's no specific diet. Yung sinasabing mga anti-inflammatory diet may or may not work for this. But I would really want you to exercise regularly to strengthen your muscles. So you don't want to add more weight to your body, so it's best if you just go swimming. No jogging, but simple walking, around the house, around the village, or wherever you are. Now, people also ask me about supplements. Well, the studies on this are not really very certain. We sometimes think it's placebo effect, only because when you drink supplements, you really don't know where they go. Now, what about gout? This is a typical picture. 75% of the time, it will affect the base of your big toe, and they really look red. Yung tinatawag naming nangangamatis, red and tender. You just touch the surface of this joint and, it can be so excruciating. It is the inflammation of the joints secondary to uric acid deposits. Did you know that Filipinos and other Polynesians have the highest incidence of gout worldwide, and they think it's racial? They think we lack the enzymes for the breakdown of the end product of food, which is called purine. So this is how it looks like. This is what I was showing you earlier. You have this big inflamed base of the big toe, but if you look underneath, you can see uric acid inside the joint. Now, uric acid is called monosodium urate. If that sounds familiar, because vetsin is monosodium glutamate. And you know how vetsin looks like? They're needle-shaped, sharp crystals. So imagine that embedded in your cartilage, and that can really cause bad inflammation. You can get that in your knee, in your ankles, big toe, elbows, wrists, fingers, and they can be unsightly and very painful. Some of the complications would be this huge accumulation of gout, of crystals, either in your fingers, in your elbow, and even all the way up to your ears. But the worst that can happen is having these accumulate in your kidneys. So you may end up with kidney stones and eventual kidney damage. I've had patients who had to undergo dialysis and eventual kidney transplant, all because their uric acid was so high. So what are the risk factors for gout? Obviously, diet. You have to make sure your purine intake is low. When you're obese, or what we call as metabolic syndrome, this is a set of medical conditions, meaning you have diabetes, hypertension, your bad cholesterol is high, your triglycerides are high. These all contribute to your uric acid being high as well. When you're taking certain medications like diuretics, thiazide diuretics, we call that, or low-dose aspirin, or maybe it's just really in your family, we've seen that you do not have the enzyme that will break down purine. There will be eventually this manufacturing of an artificial way of delivering that enzyme in the future, but right now, we're not there yet. Recent surgery or trauma can precipitate an attack. And age and gender, what does this mean? Do you know that being female actually protects you from having gout early on in life? But once you hit menopause, it equalizes. And what do I mean by that? Here's a graph of how your uric acid levels go up. Notice, in females, the red line, it's not as high. You don't develop gout until you hit menopause, because it is our female sexual hormones that protect us from having elevations. But for the males, they can get it very early. because they don't have estrogens. So what can you do? You try to hit a goal of 5 to 6 milligrams per deciliter in terms of your uric acid levels. Anything higher than that makes you predisposed to developing gouty attacks, as you can see in this graph. How can you prevent gout? Drink plenty of fluids so you can wash it out in your urine. And I'm not saying, some juices and all. No, as a matter of fact, it's just water. Drink a lot of water. And high fructose corn syrup, which we find in sweetened drinks, can actually even cause higher elevations of uric acid. Limit or avoid alcohol. Limit your intake of red meat, fish, and poultry. Then you may get your protein from low-fat dairy products if you want. Maintain your desirable body weight, and do not start fasting or getting into these rapid weight loss programs because it can temporarily raise your uric acid levels. And finally, please regularly exercise. That will really help. You can check online what a low purine diet contains, because purine, as I said, is the base wherein if it is not broken down, leads to high uric acid levels. Finally, osteoporosis, which just means the thinning out of your bone, which you can see from left to right, the minerals inside your bone, you start losing this. And so it becomes very porous and brittle. So technically, the definition of osteoporosis is low bone mass with damage of the microarchitecture within the bone. This will lead to brittle bones and you'll end up with a high fracture risk. The most affected areas will be your spine, your hips, and your forearm. However, unfortunately, you may not feel anything until you get the fracture, and that's why this is called the silent epidemic. If you had it x-rays, unlike osteoarthritis where you had the spurs, this time, nakita ninyo yung bone na PPP. They fracture, they get broken down because walang laman. So you can get acute vertebral compression fractures and they can be very painful. If it's in the hip, the moment you fall, you can crack your bones, and the only way to repair this is having surgery. You get a hip replacement. And other consequences, aside from the fractures with the severe pain, you get disabled, and within the year, there's a higher chance of developing a secondary fracture. Unfortunately, it also leads to higher mortality and hospitalization rates. So what are the risk factors for osteoporosis? Again, as you grow older, can't help it, there's a higher chance you'll be osteoporotic, and menopause, as our female sexual hormones actually protect us from getting osteoporosis. You lose 1 to 3% of bone every year after menopause. If you ever had a previous fracture before, if you had a family history of fractures, that could also make you more prone for this. In terms of other conditions, if you are on steroids or thyroid hormones, or you're really hyperthyroid or have had rheumatoid arthritis, these are the ones that are at high risk of developing osteoporosis. And as far as lifestyle items are concerned, smoking and caffeine and alcohol intakes are big no-nos. So please just try to prevent it by just quitting, limit your caffeine, which I will be explaining in a while. This time, calcium supplementation can really help, and we suggest that you take calcium at a dose of 1,200 milligrams a day. Make sure you drink a lot of water when you take calcium. You can supplement also with vitamin D3 at 800 to 1,000 IU or international units a day. Avoid or limit caffeinated drinks and alcohol. You stop smoking and do your regular weight-bearing exercises, and this can just be walking and you're good. Have a bone mineral density test. As I said, don't wait for symptoms to occur. When that happens, that means you have fractured. And do some fall prevention strategies, which I will explain in a while. This is how a bone density test looks like. Very simple, minimal radiation, and we advise this for all menopausal women, 65 years old and above, those who have fractures already, who are not yet that old. For males, more than 70 years old and above, so you can tell your spouses about this, and those with those risk factors I explained earlier. So we were talking about, this lecture is really about rethinking pain, aging, and power. And what does that mean? When I want you to rethink pain, you have to look at it this way, that pain is inevitable, but suffering is optional. So you are able to empower yourself. First of all, do not self-medicate, especially with steroids or even those non-steroidal anti-inflammatory drugs, because they can be contraindicated for you, meaning if you have stomach, kidney, or even heart problems, you may end up with complications from these, especially those taking blood thinners. You could bleed. So the safer alternatives will be paracetamol or topical anti-inflammatory medications. You could try non-Western methods such as acupuncture and physical therapy. Now, what I want you to do at home, keep proper posture, don't slouch, and you can use also ergonomic furniture. Regularly exercise and keep yourself physically active. You could do relaxation techniques, do affirmations, meditation, you pray the rosary. Fall prevention strategies, please mind your carpets and look for other objects on the floor like the toys of our apos. Get them out of sight as you might trip on them. You place railings in the bathroom when necessary. Sit down when you're taking a bath. It's not shameful anymore at our age. And use the right footwear, because usually it's just a matter of slipping when it's in a slippery air or when it's raining. So just watch what you wear. I want you to also to rethink aging, because people always say it is lost youth, meaning hindi na ako bata. Pero technically, it's really a new stage of opportunity and strength. So when I want you to say, I am an old girl, and you have this mentality that all these new medical conditions are coming in already, rethink that. That's not technically what you should be afraid of. Because being an old girl, you can empower yourself and not get rid of this, but you can replace it and say, I can do this. Rethink your power. Get that change of mindset and heart set. Be physically active. Regularly exercise. Get regular medical checkups. On the other hand, you start balancing your life. Get enough rest. Have fun. Re-energize. Watch what you eat. That's called mindful eating. Mental hygiene. Watch what you watch and listen to. And finally, may I remind all old girls, nothing beats a really sound spiritual life. So, thank you very much, everyone. I hope you learned something from this short sharing from High School Class 75. Thank you for your kind attention.